There's a lot of factors that go into using an SI joint belt properly in order for it to be effective. And so today we're going to talk about the different factors that are involved in using this belt properly, and we're going to go through a comprehensive guide on how to do it. So the first thing that you want to be aware of is that if you strap this belt on around your waist, around your SI joints, and your SI joints are out of alignment, it's probably not going to feel very good. So it might be a good idea to start off with an alignment exercise that can potentially pop them back into place. And you can often do this yourself by getting down on the floor, doing a little bridge, and you can use this belt actually in a different way to stabilize the joint, potentially get it lined up. And if that doesn't work, there is another tool we can use that can help do that as well. So what you want to do is take the SI belt, strap it around your thighs just above your knees, and you don't have to make it too tight, just strap it together. Get down in the bridge position. You're going to want to push out into the belt with your knees, bridge up, and then you can really crank on that belt and push out as hard as you can. And sometimes that is enough force to kind of pop them back into place, make them feel really good, and feel free to press out as hard as you can. You're not going to hurt the joint, you're actually just stabilizing it. And do it for a while. You can do it for up to 30 seconds. You can feel the muscles start to fatigue, maybe even relax into a better position. And very often people will feel really good after that. So you can get up, walk around. If it feels good, then that might be a time to strap the belt on. But if that doesn't work, if that's not enough, then the other thing we can try is getting a ball or something that you can squeeze between your knees. And this would be for the case where maybe your SI joint is a little more out of alignment or a little stuck. And so you don't need to bridge up for this one. Actually, we're doing the opposite. We're actually separating the joint. So this will maybe do a force opening, which will allow it to then shift into a better place. So just relaxed on the ground, and then you're going to squeeze your knees together as hard as you can and see if you maybe feel a pop or just feel any kind of adjusting happening there. What's happening, the joint is opening in the back. The harder you squeeze, the more force is going to cause that to open, and then you can relax. Another thing you can try is muscle energy technique, which is just going to be pushing into one knee, pulling against the other. So this knee is pulling up towards you, this leg is pushing away from you, and you're going to get opposite forces in your legs. You can try that on both legs. So now I'm pulling this knee up, pushing this knee away, and resisting it with my hands. And just do a little bit of exercises like that to maybe shift that SI joint or those SI joints into better alignment. And I would recommend finishing with the belted bridge, because it is a good idea to stabilize the joint after doing any adjustments or alignments before strapping the belt on. So that's my favorite one. It's the most effective one, gives the most relief, and it stabilizes so that when you get up off the ground, maybe it stays in place. That's the whole point with an SI belt. So the SI belt's job is to stabilize or brace your pelvis in position. So once you get it in alignment, or at least in a better alignment, then you want to brace it with the belt. And pardon my old, ancient, antique belt here, but this is the actual belt I used probably 12 years ago, for on and off for about 2 years, when I personally struggled with SI joint pain and instability. And so to give you hope, I have not touched this belt in probably about 10 years, and I still have it. It's got some rust on it even, but it was effective for me, along with the other things that I did for my body, to the point where I no longer struggle with any SI joint pain at all. Let's start with a little tutorial on where to put the belt, because that's going to be the next most important thing. So you want to just get it loosely strapped around you, and then you want to find the placement. It's best to do this in the standing position. The other way that I have put the belt on when I was really inflamed or in a real acute situation was actually in the bridge. So I would bridge up, make sure you're bridging in a healthy way. If you don't know how to do that, core balance training is a really good place to learn a healthy bridge. And so bridging up and putting the belt on is a good stable place to do that. So you're going to place the belt right above your ASISs, which are the two bony prominences on the front of your hips. You can feel the ASIS bump as like the only prominent bump around. If I went this way, it's soft, it's my gut and my belly. If I went to the outside, it's just more bone, but it's not a prominent bump. So it's right on the front, and that's that prominent bump that you can feel with your fingers. These are your landmarks. And you want the top edge of the belt to be right in line with the landmark. So that's in the front. And in the back, this is going to be harder to feel, but you basically, your guide to find the landmark in the back is where is the pinpoint of your pain. And that's where you want to put your fingertips, on the pinpoint of your pain. And that's most likely going to be the PSIS. And so get your fingers right on the point of pain, and if you feel a little bump there, a little bony prominence there, then that's where you're on it. And so you want the belt to be going right across that area. So the middle of the belt is going right over that point of your pain, or the little bony prominence that you feel, called the PSIS. One trick that I've found to be extremely effective is if you take the part of the belt that you pull tight and move it into the back. And that way, when you are pulling tension into the belt, it's actually causing more of a force closure in the back, and rather than pulling more force closure in the front, which actually opens the back. So that is something that you're not going to find in the instructions of the belt that you buy, or you may not see it anywhere else, but it is biomechanically a very effective way to get the result that you're intending, which is to stabilize that belt. You want it to be closing in the back. And so pulling the tension in the back is going to be a much preferable way to do that than pulling tension in the front, which is going to bring the front together and actually can sometimes cause pain in the back because you're tensioning the ligaments that are injured. And so the placement of the belt is not going to be an exact science all the time. So if it doesn't feel right to you initially, you might want to experiment with raising or lowering the belt a little bit. Especially in the back, because it might feel more comfortable for you if we drop it down a little bit lower. And so that is something that I would encourage you to explore. But what I've found through lots of experience and also clinical experience is that the top of the belt lining up with the ASIS in the front is a pretty good landmark. In the back, you can go a little bit lower. Typically, you don't want to go too much higher, but it is worth experimenting with on your own body. Other thing that we should talk about is how tight to put the belt. So naturally, if you are using a brace, you want to have it pretty tight, and you want to have it tight enough so that the joint is not able to move inside that brace. And so I do recommend pulling it as tight as you can feel comfortable with, but this is an art. This is not something that you want to just max out 100% tightness. You want it to feel nice and snug and give you a feeling of stability. And so you want to make sure you're lined up before you do that. So I got my thumbs on my ASISs right on the top of the edge of the belt. I have the back of the belt right over the middle of where the pain is, the PSIS, and then I'm going to find that strap, and I'm going to pull nice and tight and strap it down. And so I would say I put like 70% effort of pulling tight on that. And it does feel like my pelvis is stabilized. It's like a retrofitting on your house for an earthquake. You want it to prevent the shaking of the structure of the pelvis when you're walking around, moving and doing things in your daily life. So with this type of belt, this is the SI belt from the Saunders group. It is meant to go on the skin. It has a grippy type of substance that makes it stick to your skin, but it also doesn't allow your skin to breathe. And this, over a period of days and potentially weeks, will cause rashes and irritations on your skin. So you're gonna wanna take breaks from having this strapped directly to your skin, and there's a couple options you have. Number one, you wanna take a break by taking the belt off at the times when your SI joint is gonna be naturally the most stable. And that time is, number one, gonna be when you're sitting on both sit bones symmetrically. My SI joints are actually very stable in this position because the sacrum is a keystone that fits between the two halves of your hemipelvis. And so when the two halves of your hemipelvis are stabilized by sitting on your sit bones, that keystone actually is very snug in its anatomy. And so sitting symmetrically, meaning you're on both sit bones, not crossing your legs, not leaning to one side, is an inherently stable position for the SI joints, and a time where you can maybe not take the belt all the way off, but at least loosen it. So you can just take the tension out of it so it's just sitting around you loosely, so your skin can breathe under the belt. But it's not off and forgotten about, so that when you do need to get up and go do something, you just pull it tight and you're on your way. And this ideally, again, would be underneath your clothing, so you get that better grip and better effectiveness of the belt. So another opportunity for some people to give their skin a break and take the belt off is when you're sleeping. So some people will have trouble with SI joint pain while they're sleeping and may need the belt. I would recommend having another type of belt made of a cloth material that does allow your skin to breathe. This belt is one from 12 years ago as well. I didn't use it as much because I didn't feel it gave me as much effectiveness as this belt, but this one is by Cirola, and it does allow the skin to breathe. And if you are a person that struggles with SI joint while sleeping, it may be related to your sleeping position. So side sleeping is more stressful on the SI joints, and I do explain the mechanisms why, and an excellent solution to that if you are a side sleeper in a separate video about sleeping positions. So let's talk a little bit about strategy, which is the other major factor in using an SI belt effectively. You don't want to use an SI belt forever. And so how do you use an SI belt and wean off of it so that you are not creating a new problem in your body of becoming dependent on the belt? So initially, you're going to want to use the belt more often, and this is going to be for people who get benefit from using a belt. So that's a prerequisite, that you actually feel benefit. Some people won't feel benefit for maybe the factors that we talked about before, or maybe just their specific condition isn't really helped by an SI belt. So if you're getting help, then you want to use it initially a bit more, and that might be for a week or maybe 2 at the max of wearing it nearly all the time and only taking it off or loosening it to give your skin time to breathe. The next stage after that 1 or 2 week period of wearing it nearly all the time is going to be wearing it most of the time, but not at times when you are doing something very casual or easy, like standing or sitting or working at your computer. And so these are times when you can take the belt off maybe for a few hours out of the day. But if you're doing something more active like walking or chores or yard work, you're going to want to be wearing the belt. And then this stage is going to be about 1 to 2 weeks as well. And then this third stage is going to be the longest stage. And this is going to be only wearing the belt during vigorous activity or exercise. And so maybe you're doing yard work, or maybe you're in the gym doing training for stabilizing your SI joints. These are the times you want to be wearing the belt, and you want to have already weaned off the belt when you're doing low intensity or casual things, so that you don't develop that dependency, both mental and physical, on something that would be considered a crutch. And so when we are doing this whole process of wearing an SI belt and weaning off of it, you want to make sure you are complementing that with therapeutic exercise to stabilize your pelvis, your lumbar spine, and even your hips. It's the lumbopelvic hip complex that we're dealing with that you want to be strong and stable. And if you don't know how to do that, that's an entirely separate video, and maybe even many videos of a topic. And I've actually already laid this out for you in core balance training. And this course does do a really good job of guiding you through the process of stabilizing this lumbopelvic hip complex so that you can get on with your life and to do the things that you enjoy doing without hurting yourself. So I hope you enjoyed this tutorial on how to use an SI joint belt the most effectively. I'll be back next week to talk about a different topic related to getting out of the back pain cycle for good. And until then, get down on the floor and connect to your core.